Hey guys, good evening y buenas noches. I'm Amy Posada.
And I am Chelsea Valenzuela Cooper, and we want to welcome you to Amigas Unplugged.
If you're watching us on Facebook or any other streaming platform, make sure to like and to follow us.
And if you're watching us on YouTube, make sure to like and subscribe.
Please share our podcast with your friends and your family. We would really appreciate it.
And also, guys, on our very next episode, we're going to be doing our first giveaway. So, one, it's going to be something really cool. I kind of actually want to keep it for myself. Second, if you want to win free merch, surprise goodies, and all that good stuff, share our YouTube video with the hashtag Amigas Unplugged or tag 5 friends and family in the chat under this video on Facebook. You'll immediately be entered. Again, either share on YouTube or Facebook and tag 5 friends or family below to join in on the conversation.
Hi, everyone who is watching. And yeah, don't miss out on our giveaway, guys. Share our podcast or tag some folks and get entered in. Cool. Now, let's get right into the Cheesemate, Chelsea. Talk to us about our hot topic for today's episode.
So, our hot topic for today is mental health in the Latino community and how it is still, it's taboo. Is what we're going to get into, and what are y'all's thoughts on that?
Yeah, so first of all, let's break it down. So what is taboo, right? Obviously, we know what mental health is, but what is a taboo and what's the actual definition? So there's actually 3 definitions for the word taboo, and honestly, all combined, they make more sense. So I'll give you guys all 3 definitions. So the first definition of taboo is a social or religious custom prohibiting or forbidding discussion of a particular practice or forbidding association with a particular person, place, or thing. The second definition is prohibited or restricted by social custom. I think that's my favorite one. And the third definition is a place under prohibition. So let's talk about it. We would love to read some of y'all's opinions on the comments if you have any below. So how is mental health taboo in our community? How has it personally affected you? How have you personally been affected by that? Chelsea, want to give us your thoughts?
All right. So this is a lot. I believe that in the Latino community, we are basically pre-programmed to be resilient, right? Like, you're taught very early on, like, shh, don't say what's going on. It's fine. Pick yourself up and continue going. Like, you don't stop. And what happens inside the house, our home, and with our family, we don't ever talk about. We were raised that way. That's just how it is, right? And if you do, happen to speak out loud or speak out about it, you're a crybaby. You can't handle things, and now that I'm thinking about it, sitting here and as an adult, when I was younger, there were definitely things that went on, and I have a big family, things that went on, and I know that they were rough and they were tough and not easy to deal with. And thinking back now, I'm like, dang, how did they get through that? Like, nobody ever said anything. They just kept going. So there's that part. And then also, for me now as an adult, I think I'm actually a little desensitized to emotions and issues. If people talk to me about their issues, not that I won't listen, I'm always down to listen,
right?
But I'm thinking, like, dang, they really could just figure this out real quick. Let's pick it up. Let's pick it up and get going. But it's not because I'm being mean. It's because that's what I was taught. I mean, I was taught to just keep going. You know what I mean? But yeah, what do you got going on over there, Amy?
Yeah, no, I'm everything that you said, I think is like spot on. And I kind of want to take a step back a little bit, because I think it's really interesting. Just kind of the fact that it is taboo, right? And like learning the definition of taboo and mental health in our Latino community and kind of how it all comes together. So the definition of taboo is to basically have, and this is my opinion, this is my outlook, but it's to have a quote unquote prohibited and forbidden pair of glasses on when looking at something. And in my opinion, the reason mental health is a taboo in the Latino community is because we are forbidden and we are prohibited to appearing weak and potentially doing anything that can hurt the family name. That's my opinion, right? And I think that
Yeah.
that's such a no-no in our culture. And I spoke with someone, he's a really good friend of mine. He didn't want to be given a title or anything like that. He didn't want his name to be shared, but he has been at the forefront of the mental health advocacy battle line. He's a member of NAMI, which is a National Alliance on Mental Illness. He is Mexican American, and this is what he had to say. Ready?
I'm ready.
So he said, for Latinos, but especially in the Mexican culture, strength, power, and resilience are three things that you want to be known for. And in order to embrace the idea of mental health, you have to admit that there are some areas that need improvement and need attention. And if you admit those things, you have to let your guard down, which in our culture makes you weak and opens you up to a scandal and criticism by others. And most importantly, ready? Embarrassing the family name and being labeled as loco or loca, which is crazy. To talk about your feelings, you are weak. To admit you have issues, you are weak. To say you are depressed and have anxiety, you open yourself up to being talked about. What would the neighbors say? What would the church say? What would your friends say? How embarrassing. Wow. that was really
heavy.
That was heavy. That was really deep. And what he said, it 100%, I mean, it's what I believe too, and I'll expand a little bit on it. I think as people, in general, right? No color, no race, no ethnicity, no nothing. As people in general, we have a hard time admitting when we have problems or even that there is a problem to begin with, right? And in our culture, right, in the Hispanic and Latino community, we have this Band-Aid approach where we just want to get back up and wipe things off. And to be fair, and I'm going to, to be fair, as a mental health advocate myself, I think the mental health community needs to do a little bit more of that, because now it's all about sulking and being a victim about everything and using your mental illness as an excuse for absolutely everything. But before we even touch that idea and that thought, we need to get to step one, okay? And that's admitting and understanding, and ready for this, accepting that we have an issue to begin with, whether that issue be trauma or depression or bipolar or OCD or PTSD or whatever it may be. And when you do that, when you accept that, you have to address it. You have to get help, and you have to see someone and make a plan of action. Now, the way that I always put it to people who are not really big on mental health or familiar with mental health or even with just like the basic concepts, I always say it's the same thing when you have diabetes or any other medical condition, or asthma for that fact, right? For example, I have friends that refuse to accept the fact that they have diabetes, and they don't take care of themselves. They just don't. And then they're running to the doctor for diabetes related issues. It's the same thing for mental health stuff, except because the word mental is in front of it, people think we can just sleep it off or just shake it off and just get over it, when it needs to be treated and addressed, and it needs to be, it needs to be taken just as seriously as any other medical issue. But that's just me.
Yeah.
Right. Yeah.
Yeah, no, I I completely agree. Something that stuck out to me is from what Amy said was the part where she says, to say you are depressed and have anxiety, you open yourself up to being talked about. What would the neighbors say? What would the church say? What would our friends say? How embarrassing. So this for me, this kind of hits home because I remember as a kid, and I don't want to say too much because I don't want anybody to get mad at me. So if my DAs are watching later, just know I'm not saying a whole lot. There was things that would go on, and I remember like extended family things would go on, and I remember my grandma telling me, like, and it was bad things, things that they're really going through it, and she would say, like, why would they share that? Why would they say that? But that goes back to, like, we're pre-programmed to think and feel that if we speak out and if we say, hey, I don't feel too good, then you're one, you're weak, two, you're embarrassing. That is the underlining thing. And like Amy said, the first step, I believe, just like she believes, is accepting. The second part is going to be, this is a generational problem. This is your parents were raised like that, your parents were raised like that by their parents, and then they turned around and raised us, like the Gen Xers and the millennials, to kind of have this mentality of go, go, go. Nothing's wrong. Everything you're feeling,
Mm-hmm.
shove it deep down. Don't worry about it. And you definitely don't talk about it. We need to stop that. We need to start making people feel like they can't talk about how they feel, and they can't talk about when they're needing help, because a lot of times um you'll see if somebody, and this is gonna go kind of on the dark side, but you'll
Mm.
see people who have taken their lives, and their family will say, well, they never mentioned it, they never talked about it,
Mm.
they never, of course they didn't, of course they never said anything. Why would they? And this in the Latino community is an issue. We don't talk about things. We don't
Right.
talk about um, mental health because we don't want to be vulnerable. Because we're taught not to be. You are stronger than the person next to you.
Right.
Um, but I think, like, with that being said, I also wanted to note that according to SAMHSA, 22% of Hispanics and Latinos suffer from a mental illness. So that's a bit more than 1 of every 5 Latinos. So this is definitely something that affects our community. It's a huge, huge deal. Um, I want to jump into last week. We got on our socials and asked directly, like, why do you think mental health is taboo in our community?
Mm-hmm.
So we want to share some of those. We got a lot of responses on Instagram and Facebook. So thank you guys for sharing. Somebody said, there's just this get over it mentality. That's, yes,
Mm-hmm.
absolutely.
Yep.
Another person said, we don't want to appear vulnerable or weak. Of course not, because if we do that, we stand the chance of embarrassing our family, right?
Mm-hmm.
Somebody said because it's all in our head. With the laughing faces, she also added the laughing faces. This is a really good one. So I think it's because therapy didn't exist in Latin countries for a while, and even after it was inaccessible. So, for generations, mental health issues were swept under the rug
Mm-hmm.
because talking about it out loud was shameful. So, even if someone's a fourth generation Texan, the idea that you should keep those thoughts to yourself were ingrained in childhood. So,
Mm-hmm.
that really like hits me hard. That is exactly it. That's exactly how I was raised. Now, I will say that as an adult, like, um, most of the time, I'm pretty resilient to just chaos. Like something happens, I can handle it. I just keep going. That's the way I was taught, and for that, I am thankful. I'm thankful to be taught to be strong.
Mm.
But on the other end of that, as a parent, it's kind of like, oh wait, hold on, I need to stop this generational issue, and I need to be able to let my kids know that they can tell me when something just isn't right.
Right.
Also, guys, we got a comment on Facebook that said, for some reason, the fear of being judged is instilled early on. So what you guys get from this is we're all saying the same thing. Y'all's opinions are like ours. We're just saying it different ways.
Mm-hmm.
In our research for this episode, Amy and I did a deep dive on the interwebs. By the way, guys, there's a lot of things out there. Um, go look on Reddit. You'll be mind blown. Anyway, so we got 2 stories off of there that really stuck out to us. So I'm gonna read one. Amy's gonna read the other. So the first one is, here we go. Meryl said, from my experience, my boyfriend and his large family are Latino. They don't discuss things like depression, anxiety, OCD. Even though I know OCD runs in the family, when I had to share with them that I had a serious eating disorder, they didn't ever want to discuss it or ask how I'm doing, even since I went to treatment for
Mm.
2 months and came back. My boyfriend and I have communication issues because he doesn't open up about his feelings.
Wow.
So she goes on to say, she really cares about feelings. She feels empty around him. He's willing to go to therapy. She doesn't think he's going to get much out of it, yada, yada. Not that I'm trying to downplay that situation because that is important.
Mm-hmm.
And she says, like, I often wonder how much of this is cultural and how much of this is his personality and his family in particular. I would hate for cultural differences to ruin our relationship. I'd love more insight on this issue. So she's asking for advice, right?
Mm-hmm.
Something that really stuck out to me about this is I can see it two ways. I can see like her basically being like, wow, these people really don't care about me. They hate me. They're not asking how I am. Then the brown girl in me can see, like, if it were my sister-in-law, I might not bring it up because I don't want to embarrass her because
Mm.
we don't talk about things like that. I don't want her to feel bad. So I definitely see it from both sides. And the other thing that sticks out is he doesn't open up about his feelings. No,
Mm-hmm.
we don't. We were taught not to. So that's a whole other thing. But Amy, do you want to go into yours?
Yeah, and really quick before I hop into this next, into the story that was submitted to us, I think, and you can tell me what you think, Charles, but especially for men, like the machismo that like runs so deep in Mexican culture, and you know, for all I know, he's not even Mexican, right? But like it just runs deep in
Imagine.
Latino, it just runs deep in Latino culture. Is to talk about your feelings, that's a girl thing. You don't talk about
Yeah.
that. Like that is reserved for women. Like that is like you save that for women. So, you know, I think one, you have that preset, right? And then you have obviously just the culture, right? Which is like it's just taboo, right? So there's like several layers of this. But yeah, so let's get into our second story that was submitted to us directly. And before I read it, I just want to say to this gentleman, I am we're so grateful that you submitted your story to us and that you trusted us with this information. So he said, and by the way, he is a first generation Hispanic male in Texas, and this is what he had to say. Quote, when I was 20 years old, I was diagnosed with multiple mental illnesses. And when I told my family, they immediately told me, number one, never ever share this with anyone, not even my close friends, but especially not with family. And number two, this was a spiritual battle, not a medical one, and that I needed to go to church and pray more. Years later, I shared with my parents that I was on medication for my illnesses, doing very well, and they were abhorred, telling me that I needed to get off them, telling me there was nothing wrong with me and that I needed to stop being selfish and think about other things other than myself, that I needed to keep myself busy and think about other things. Isn't that the craziest? That's just wild. But I mean,
That it's insane, but it's so relatable.
yeah. And I think, and as, so, and I've mentioned this before, I was a mental health advocate for a while. I was involved in local chapters in San Antonio, mental health chapters in San Antonio. This is actually not like, you know, some of you guys might think like, what, are you serious? But no, like, I mean, this is very common. I remember, talking to a girl who had schizophrenia, in San Antonio, and both of her parents got, I think, with her Pentecostal pastor, porque estaba endemoniada, right? And in English, basically, that means like you're possessed by demons. And
Imagine.
yeah, no, imagine though. No, and but yeah, no, I mean, and so this is very you know, this is really common because religion is also really, it's a pillar of our community. It's ingrained in
Mm-hmm.
everything that we do. So of course that's going to be first base, right? It's going to be faith and spirituality and religiousness. But you know what I think is really interesting, Chelsea, is when the parents told him, never ever share with anyone, not even your close friends, but especially not with family. And I'm thinking it's extended family, right? Because, you know, like días can be chismosas and
Yeah.
stuff like that. And I know you mentioned earlier, right? Like there was some stuff going on in your family that is like, hey, that should have never been shared, right? Like, but that was really interesting for me to hear, or for me to read that from him, right? Like maybe you can't even trust your family nowadays, right? Maybe extended family nowadays. Yeah. What do you think about that?
I, bro, you just sent me to outer space because I think that, well, one, okay, that part also resonated with me. Like,
Mm,
do not tell anyone, especially family, because
mm,
I've been like I'm accustomed to that, right? In our big family, like there's the brothers and sisters, there's the first cousins, and then that's the big family, and then we have a large extended family. And things that you don't talk about, things you're not supposed to. And I think that this has been so ingrained to us that even as we grow older, we are still silent. So I'm going to give you an example. One of my cousins struggled with postpartum depression, and she's younger than me. So she's younger than me. She struggled with postpartum depression. She didn't talk about it till years later. I think it was maybe about a year or two. I could be wrong. And I remember when she shared it, which one was really brave of her, really, really brave of her. And I was proud of her for sharing. And at the time I was thinking like, dang, I wish she would have said something, because, like when I had my girls, I also struggled with postpartum depression really bad. And if I had known, I would have done anything I could to help her. But then like I started thinking about it. And of course, my first thought is like, dang, she really didn't trust me to tell me. But it's not that. We were taught not to talk about these things. We were taught not to talk about our feelings. You don't talk about what you're feeling. And that is a big issue. And it kind of makes me sad. And I know, Amy, you and I have talked about this in depth. Like, it kind of sucks.
Yeah. So, okay. So let's kind of let's do a little bit of a full circle. So, we got a lot of things that
let's circle back.
Yeah. There's a lot of things here, a lot of really awesome things. Well, not awesome, but you know what I mean? Like awesome feedback that we got from you guys. So we got number one, lack of access. We got lack of education, fear, pride, shame, being too busy, strong religious and spiritual views, not wanting to be vulnerable, not wanting to appear weak, not wanting to taint the family name. Yeah, I mean, and I would even say being judged, right? So number 11, being judged, right? Being afraid of being judged, I mean, which I guess falls under fear. But it seems like, why is mental health taboo in the Hispanic community? Let's do a full circle. All of these reasons, right? And I think we've talked a lot about this. Chelsea, it's a generational thing. It's a family thing. Your parents were
generational curse.
Generational curse. That's deep.
It's a generational curse. Yeah. I mean, I think that a lot of these, I mean, they're spot on. Fear, pride, shame, being too busy, strong religious views, not wanting to taint the family name, not wanting to appear weak. Like, those are huge. I mean, and these, unfortunately, aren't things that we're going to change tomorrow. I mean, even ourselves personally, like, yeah, we're talking about it. And to be honest with you guys, like, it kind of took some convincing to ourselves to even want to talk about this issue,
right? Because
it is so taboo. We were a little nervous, like, oh, dang, should we say anything? Is this something we should skip? But it's important. And yeah. I think, like, I say generational curse a lot because it's true. And one of the biggest things is like putting a stop to it. A lot of things we see in this world are generational problems. You were taught that way from your parents. They were taught that way from our parents. Like with this particular issue, I want to see it stopped. I want to stop it with me. And, like, again, I want to reiterate that, like, I'm very proud of where I come from and who I come from and everything I was taught. And I think I'm really strong because of them. Like, if you meet the ladies in my family, they're scary. They're strong. They're resilient. That's the way I would describe the females in my family. They're resilient. And I'm so proud to be just like them. But I also want my daughters to know that, like, hey, you can be strong. You can be a baddie. You can be all the things. But if you don't feel good, you can also tell me. I'm not going to make it to where you can't tell me. Like, you don't be shamed into thinking you can't say anything. You know what I mean?
Yeah.
And that was real heavy, guys. So
yeah, no, that was super heavy. And and by the way, I just kind of want to give a shout out to my mom, because I'm so grateful for my mom, that I think she was always really great about, like, talking about our feelings, which actually brings me to something that Chelseay and I want to share with you guys. If you're currently watching this and you're going through some sort of mental health crisis and you can't share this with your primas and your primos and your amigos and your amigas, I know it might be a little untraditional, but you have Chelsea and I, we're just an email away. You can always reach out to us at contact@amigasunplugged.com. You can reach us out. You can reach out to us on Instagram and on Facebook Messenger. We're always happy to chat with you guys and actually send you resources. I know we're both mental health advocates, and so we're happy to share any resources that we have with you guys.
For sure, guys. And I'll probably tell you you're ugly when you cry, but I say it with love. That's actually a joke between me and my cousins. Like we got it from my grandpa. But yeah, no, our inboxes are always open. Inboxes, Facebook, Instagram, email, all those things.
Awesome discussion on mental health, guys. We will definitely have to do this again. Now it's time for our Let's Be Real segment. Now, some of you guys were really, really excited to hear about this, and it's probably because y'all are in the same boat as I am, in the sense that we hate to overpay for medication, right? Because if you know me, you know that I like to splurge on stuff, but especially medications, we don't we don't like to spend on medications. Okay, so let's be real. What is Mark Cuban's cost plus drug company? Well, let me read y'all Mark Cuban's letter and what he said about his company. And by the way, in case you don't know, he is a billionaire. He's been on Shark Tank since it started, and he owns the Dallas Mavericks. Actually, that changed earlier this week. So I believe he sold like a majority portion for like $3.5 billion or something crazy like that. But anyways, let me read you his letter, which is on his website. If you guys go to the website, you guys can find this. And he said, and quote, "We started Mark Cuban Cost Plus Drug Company because every American should have access to safe, affordable medicines. If you don't have insurance or have a high deductible plan, you know that even the most basic medications can cost a fortune. Many people are spending crazy amounts of money each month just to stay healthy. No American should have to suffer or worse because they can't afford basic prescription medications." Now, if you scroll towards the bottom, he explains the pricing model. He says, quote, "Our goal is to dramatically reduce the cost of drugs like albendazole, which can cost as much as $500 per course," which, by the way, I found out it's a medication for parasites or for like pinworms and stuff like that. And then he keeps going and he says, "But we also think that it's just as important to introduce transparency to the pricing of drugs so patients know they are getting a fair price. Our cost for albendazole is $26.08 per course. We mark that price up by 15% so we can continue to run the company and invest in disrupting the pricing of as many drugs as we possibly can. That makes the base price of the drug $30. When we add the actual cost, $5, that our pharmacy partners charge us to prepare and provide your prescription to you, that makes the sale price on this website $35 freaking dollars, guys. Far lower than the pricing available in the marketplace." So basically, the way that they work is that they cut the pharmacy middleman and they get meds directly from the manufacturer and they ship to you. So as of today, they have, and which is really cool because it's 2024, so they have 2,024 medications available, with the list growing every day. And as a public benefit corporation, they prioritize their social mission of improving public health. So how does it work? So number one, you find your medication on their online store by browsing alphabetically, or by medical condition, which I found really cool on their website. Number two, once you found your medication, you sign up for an account. Number three, you reach out to your doctor or provider with their provided instructions, and you can find that at costplusdrugs.com/contact-your-doctor to receive your prescriptions. Number four, once they receive the prescription from your doctor, you'll be notified to check out and pay for the meds. And then number five, your medications will be delivered straight to your door in just a few days. Now, you might be wondering if this is even legit, if this is a scam. And let me tell you guys, they
didn't sponsor us.
They did not sponsor us. This is not paid, but this is 100% legit. I actually used it a few years ago when they first initially started. I thought the idea was really cool, right? I've been on medications my whole life. I've been sick my whole life with a bunch of different stuff, whether it's asthma or allergies or whatever. And so, I started using them for some allergy medication and asthma medication. I'm actually going to break it down for each medication, because I'm currently on some medication. I wanted to break it down because I'm currently using them now. So you can see how much money it is saving me and how much it can potentially save you. Okay. So medication A, brand name retail price out of pocket for a 30-day supply is $677.70. Medication A generic price. Oh, and by the way, that first price that I gave you guys was out of pocket. Medication A generic price out of pocket, $168.71. Obviously, you always save money with generics. Now, the price that I pay for the generic with insurance, because I'm lucky to have insurance, is $30. The price I paid by using Cost Plus, $8.30. Now, the savings compared to the generic without insurance is $160.41. The savings compared to the generic with insurance, $21.70. Now, medication B, brand name retail price out of pocket for a 30-day supply, $250.81. Medication,
Good Lord.
yeah. Medication B, generic price out of pocket, $86.40. The price that I pay for the generic with insurance, $10. And you're thinking, Amy, it's $10. It can't get cheaper than that. Now, the price that I paid by using Cost Plus, $6.20 freaking cents. So the savings compared to the generic without insurance, $80.20. Savings compared to the generic with insurance, $3.80. So instead of paying $40 with insurance, guys, I literally paid $14.50, like, which is just
That's
nuts
a
to me.
steal.
It's literally a steal, right? And we're all about getting good deals around here. And what's amazing,
So we could spend our money on other things.
yes, like Stanley's. I'm just kidding. I'm just kidding.
She's not kidding.
And what's amazing is that anyone can use this site, literally anyone. You don't have to have insurance or any fancy plan, and I seriously love that. Now, you're wondering what the drawbacks are. Now, if there's any cons, anything like that, and there is, right? The issue with all of this is that if you get a prescription Monday, because it's being shipped and it has to be processed, it'll probably be Thursday or even Friday by the time that it gets to you. So you have to plan accordingly, right? Like, I'm someone that, like, with my medication, like, I run out on Monday, I'm calling my doctor on Monday and making sure that my pills are refilled, right, so that I can pick it up at Walgreens on Monday. So you do have to plan accordingly, which might be a good thing, right? It'll put the planner, it'll activate the planner in you. But so why are we talking about this on our podcast? Because, guys, because as of 2023 in Texas, 29% of Hispanics and Latinos were uninsured, okay, compared to the 12% of whites. In 2022, approximately 21% of the Hispanic population in the United States did not have health insurance. In 2022, the national average was 10.1%. So super sad, but wait, I'm not done. In 2022, 9.7% of adults did not take prescribed medication due to cost, a higher percentage than their white and Asian peers. So white folks were at whites were at 7.4% and Asians were at 6.8%. And just know that 66% of Americans are on prescription drugs. This is incredibly, incredibly sad, and our community deserves quality health care and, most importantly, quality medication for whatever condition that you might have. Chelsea, what are your thoughts on Mark Cuban's Cost Plus drug company?
So Amy said like a whole mouthful. Like, that was a lot. It was good. It was good. It was so good. So, all right, first and foremost, I hate Mark Cuban. But that's why. So if you are a Spurs fan, an old school Spurs fan, you know that our rival is Dallas. And since he was a majority Dallas owner, I've always and he had a big mouth in like the early 2000s. This dude was always saying something about San Antonio. But anyways, no, I'm just kidding. I don't actually really hate him. I think that this is phenomenal. I know so many people that can barely scrape by to go to the doctor, and then you get your prescription and they're like, holy hell, I can't get this. I know people on fixed incomes. My grandmother, 92 years old, my little Wilita, 92 years old, on a fixed income, who literally it has to sometimes she gets her medications. I'm not saying she doesn't, but
Mm,
it's a struggle because they are expensive. And we as a family have experienced things where, like my grandfather had stomach cancer. Getting his chemo was
mm,
very, very, very expensive. So I think this is phenomenal. I think that these types of companies are essential. Something that really kind of stuck out to me about this is that, like, this is a great idea. If you are listening to this later and you listen to Amy's breakdown, like the savings is substantial, right?
mm-hmm,
The
mm-hmm.
savings is great. The thing that sticks out in my head is how will the people who really need it know about it? So like our tias, our tios, our cousins that don't really do the internet and don't really do social media. Like Amy and I are on the socials, right?
Mm.
We know what's going on. But I think that this is fantastic, and it would be even better if there was a way to get it out into the community so that people know it exists, because I
Mm-hmm.
guarantee you, if I ask my mom or one of my aunts, like, hey, have you ever heard of this? They'll be like, nope, I have not.
Yeah,
um,
yeah.
but I really love it. So my husband is active duty military. We have TRICARE, and I signed up. I had seen this a while back, but I
Mm-hmm.
signed up for it. I haven't used it just yet, but I'm kind of going that way, that I'm going to use it, just because with our insurance, which, I mean, if anybody knows how military health insurance works or is, um, I pray for you because it sucks. But with the prescriptions, there's been so many times that my husband will go to Walgreens to pick up my medication, and it'll be like ridiculously expensive. And he's like, we have insurance.
Yeah.
It doesn't matter. So I'm super excited to use this. I want to use this for next month for my medications. But yeah, no, I mean, I think that this is great. I also wanted to share with you guys that, according a little statistic, because my little mathematical major over there
Hmm.
adds these statistics everywhere, and I love it. According to the American Heart Association, a study found that Hispanic people born in the US had higher levels of metabolites related to 22% higher risk of diabetes, 16% higher risk of severe obesity, 15% higher risk of chronic kidney disease, and 42% higher risk of asthma.
Wow.
That means that most of our community is on some medication of some sort. So keep that in mind. We had a comment. I just saw it. Oh, my cousin, she said Publix has a contract with TRICARE and 10 times better. Shout out to her. I have to try that. Thank you
Mm.
for the tip. But yeah, guys, so the bottom line is most of our community needs medication that they don't have.
Yeah.
So if you are in that boat, please go on the website and check it out. Sign up.
Yeah, no, and I was just thinking, like, I don't think I know a single person that is like, with the exception of maybe like a couple, maybe like a coworker or so, that like everyone's pretty much on medication nowadays, right? And especially like the viejitos, the viejitas, the aunts, the uncles, right? Like, and everyone has some sort of medical condition. And yeah, I mean, good point, Chelsea, right? Like, people need to know about Mark Cuban's Cost Plus Drug Company. That's why we brought it up on our podcast, so we could bring attention to it and how it affects our community and how it can impact our community and how it can, I mean, because this is a godsend, right? Like, I mean, this is amazing whether
This
you're
is
looking.
huge.
Yeah. And so yeah, I mean, and kind of like you mentioned the stats just now, our community has, heart issues and obesity and, some kidney disease and asthma, and we have a lot of conditions that, and all of those require medication, and I think that at the least our community deserves quality medications in healthcare. I mean, that is, which that's going to be a topic on its own later on, but yeah, I think this company is just going to do wonders, and I'm grateful that we had the opportunity to promote it tonight.
And I hope it goes far. If you're listening to this after, either rewatching it on Facebook or YouTube, or if you're on a streaming platform, I will link the URL for the website so you can just click on it and sign up because it was super easy. Like I did it the other day and I was like, oh wow.
Yeah.
And I'm all about easy stuff, guys. If it is complicated, I have no time for that. I cannot be bothered. But anyways, guys, so as promised, we have a small business shout out
Small
every single
business.
episode to support our Latino and Hispanic owned small businesses out there.
Awesome. So for today, our small business shout out goes to La Paleta, which is based out of Bulverde, Texas. And not only are they Hispanic and Latino owned, they are Latina owned. You can find
Mhm.
their popsicles in San Antonio, Austin, Johnson City, New Braunfels, and Corpus Christi in various stores like Michoacanas, stuff like that. Their top three paleta flavors are blackberry cheesecake, Eskimo, and coconut. My personal favorites are cajeta and yogurt. Chelsea will share hers later. And by the way, I just want to mention something. Their popsicles ranked second in the nation for being the best. They have actual national recognition and a legit award for it from the North American Ice Cream Association. If you want to try some and you are in the San Antonio, Texas area, they are currently running a promotion where if you order 30 paletas or more, you get free delivery directly to your house. They also have a brick and mortar store in the medical center of San Antonio. I believe it's behind the McDonald's if you're off of Babcock and Wurzbach. And they sell their famous waffle paletas. They have homemade ice cream. My personal favorite flavor is tequila. Like seriously, it's delicious. And it is a top flavor along with cajeta and gansito. A bunch of Mexican snacks, banana splits, corn in a cup, aguas frescas, and so much more.
That sounds so good. I'm so hungry right now.
Yeah,
Um,
same.
Me being in Alabama and not having my Mexican snacks.
You're
Anyways,
deprived,
guys,
yeah.
so back in, was it 2022? Maybe it was 2021.
No, it was
I
2020
actually
during COVID.
I actually ordered like 37 popsicles from them for
Mm.
delivery. And you guys know I have 5,000 kids. I actually only have 3, but anyways, that's neither here or there. So I ordered and then they had like cookies and cream, strawberries and
Mm.
cream. There was a fruit one. I honestly, I'm gonna be real honest with you. Like I didn't actually get to taste every single one of them because my little gremlins of kids ate them all, but they were delicious. So if you're in San Antonio, hit them up. Also, go to their social medias. Their Instagram is very aesthetically pleasing. They always post like as soon as you see it, you're like, oh Lord, I need that. So go check them out, go order, and they deliver. Like they deliver. So yeah, go check it out, guys.
Awesome. Okay, y'all, get ready for our next episode, which is going to be on, get ready for it, being a girl's girl. We're going to dive into the
Hmm.
real life topic of your friends not supporting you. And for our Let's Be Real segment, we are going to talk about the documentary Escaping Twin Flames on Netflix. So get ahead of the game and watch it as soon as you can so that you can be caught up for our next episode.
Guys, watch it honestly as soon as you listen to this so that we can talk about it together because it
Yes.
will blow your mind. Um, Also, being a big girl's girl, come on.
Mhm.
That's going to be huge. All right, guys. So mark your calendars for Thursday, February 22nd at 7 p.m. Central Time. And again, if you're watching this later on YouTube or listening on a streaming platform, make sure to like, subscribe, follow, and do us a big solid and give us a 5-star review. Thank you so much, guys.
Sounds great. See you later, everyone. Have a blessed night. Adios.